Okay, so we're back. We're here with our patient. We have our IV Start kit with chlorhexidine prep. It comes with a gauze, a tegaderm, our tourniquet, and our chlorhexidine cleaner. For this purposes, I'll just use alcohol to clean his arm, but this is the kit. If you don't have the kit, remember those are the things that you need: chlorhexidine, alcohol. You need a saline push, your extension tubing, a tegaderm, gauze, and your tourniquet. Okay, so again, I've instructed the patient on exactly what is going to take place. And most importantly, your over-the-calf needle. Again, it depends on what IV fluid you're pushing, depends on the over-the-calf needle that you use. For these purposes, I've selected a 20 gauge. Okay, so again, I'm going to find the vein after I've explained and identified to the patient exactly what I'm going to do. Tourniquet on and secure. Find the vein. And so I'm going to be going for this vein right here. Okay. As I mentioned in the previous video, I found the vein. I'm going to release the tourniquet. And now I'm going to prep. I flushed my IV tube extension. I'm going to open my tegaderm and have available. Okay, I always loosen a little bit of it so that way it's easy. Sometimes you can put it, just take it off and put it on the bedside. So I'll have that ready. I'll open my gauze and have that ready. It's not a sterile technique, so it doesn't need to be with sterile dressing. And then my piece of tape. And with my tape, I'll tear a long piece and have available. And then I type to tear another piece. And what you do with the second piece is you rip it in half, halfway up, not all the way, so that you can do the crisscross method that I'll show you. Okay, so one piece you tear almost in half, and you have that available. Okay, you don your gloves, or I'll put the tourniquet because sometimes it's harder to put the tourniquet on with gloves. Don my gloves. My area is clean, remember, so I'm not going to continue to go back over it trying to look for that vein. A quick tip is I like to release. So you have it, take the cap off. I like to just release, loosen up your tip from the actual cannula or the actual part that you're going to throw away. If you don't, you'll find that it's hard to try to twist and pull at the same time. So I like just to release it a little bit so it makes it an even and smoother method. Okay, so I'm going to take it. My area is clean. I'm going to tell the patient what to expect. Okay, you're going to take the cap off of here because this all needs to be done in a smooth motion. Okay, have everything ready. All right, tip up, you need the bevel upward. Okay, holding with your non-dominant hand, you want to hold so that way if there are an older person or the skin won't move as you're trying to stick them. Okay, with my dominant hand, bevel tip up, I'm going to insert, take a deep breath. blood is in return is coming out. I hope you can see it. So at the same time, I'm going to release, push towards, and push back at the same time, making sure that I have engaged and it's locked. I take the tip, secure it in place. Okay, clean up the blood a little bit while I'm holding it. Release my tourniquet. That's the one hand motion up. Okay. And then if it is the secure locks, I would put that on. If it's not, then I would make sure that I would secure it. I'm going to take my tape that I divided, put it underneath. Okay, this can be moved because you have secured it. Okay. Move my tegaderm and release it. And then I crisscross the tape to, again, give another security level so that my IV can stick in place. Okay, and then I would pull back for more return. As you can see, he has full blood return. And then I would push to flush. Again, checking the site, making sure that there is no infiltration, no phlebitis. Once it's good, then I can disconnect my saline lock, and I'll either connect it to the IV or I'll put a saline lock on it, which is the green locks at the hospital, and I would take the second tape that I had to get it out of the way and secure it. And this is initiation of an IV. And if you can notice, there is no white of the cannula showing, and that is important. You don't want that to show. If it shows too much, a lot of hospitals, that's against their regulations, and you would have to redo it again. So make sure the cannula port is pushed all the way and flush with the skin, and then secure. I hope you enjoyed. Please continue to repeat this video so that you can see, because I don't think my mannequin will let me repeat the demonstration on him. Thank you so much for watching, and keep practicing. I know it's hard without a dummy hand or someone to stick, but I want you to continue to practice everything else. Thank you.